Good afternoon, good morning, good evening, wherever you're joining us from today. My name is Joe Jewell. I'm the Director of Cities for Better Health, and welcome to today's Cities Health Tech webinar. Today I'm going to be guiding you through the session for this City Health Talk, and today we're going to be exploring how co-creation can strengthen community health promotion and health equity programs. Co-creation is an incredibly important tool for public health, and it ensures that the initiatives and interventions are not just designed for communities, but they're designed together with communities. But today we're going to be exploring what successful co-creation looks like in practice and what makes it particularly valuable for building trust, inclusion, and lasting impact on urban health. We've got a really exciting discussion ahead of us today. We've got two great speakers joining us from Denmark and abroad in Canada. And we're really looking forward to leaning into their expertise and also building on the real-world examples that they've worked with around how to practically apply co-creation in action. Before we begin, thanks so much to you in the audience for joining us today. So please do drop into the chat where you're joining from, what your background is, and what your prior experience with co-creation is, because we're really keen to also build that into the Q&A and discussion section where you'll have your chance to ask questions. So do also remember to look at the Q&A box and add your questions as we go along, because we'll be collecting those. And when we get to the Q&A section of the discussion, I'll be working through your questions and putting those to our speakers. We're really hoping for a very dynamic session. We have some short introductions and short overviews from our speakers, but plenty of time for discussion and debate amongst ourselves. So let's get started. We have 1 hour. I'm really pleased to welcome our guests today. So first of all, we have Danielle Agnello, who is a postdoctoral researcher at the School of Global Health at the University of Copenhagen. Danielle's research has been focusing on co-creation as a scientific methodology, really looking at what is the evidence base out there, how does it work in practice, and how do we evaluate the benefits of co-creation, with the purpose of breaking down the silos between researchers, policymakers, and communities to create more sustainable and impactful health solutions. Also thrilled to have with us Tiffany Bartlett, who is joining us from Toronto. And Tiffany is the Director of Research Programs, Operations and Partnerships at the University of Toronto. I said Mississauga because we're working with her on lots of projects in Mississauga, but she's actually at the University of Toronto. Tiffany has over a decade of experience in public health and collaborative research, leading initiatives that are addressing health, social, and environmental determinants of health through community-driven projects with co-creation at the heart of those initiatives. So thank you both for being here and making your time available to us for this important discussion. I'm really excited for your inputs and to hear your expertise. Before we get started and before we dive into the conversation today, we really wanted to set the scene, and we've prepared a short video which gives you a quick recap of what co-creation is all about and what it looks like in action. So let's take a look.
Public health interventions often face a common challenge. Ideas are designed without involving the people they're meant to help. Co-creation changes this. So, what exactly is co-creation? Co-creation means developing solutions together with communities and not for them. For example, policymakers, public health professionals, and community members work side by side, equally contributing to the planning and implementation of health initiatives. How does co-creation work? Engage those with lived experiences and relevant expertise to identify the true health issue together. Bring together those that can influence the health challenge and potential solution. This includes local leaders, public health professionals, community members, technical experts, and policymakers. Everyone who can influence the health challenge. Brainstorm and create collectively. Every participant shares insights and solutions, ensuring the co-created solution addresses real-life needs and experiences. Collaboratively decide on actions and design interventions that are appropriate for the local people and context. Implement together. Those engaged in the co-creation process may play a vital role in bringing the shared vision to life. Why does co-creation matter? Because it leads to practical, acceptable, and sustainable health solutions. When people actively shape solutions, they're more invested in making them succeed. Co-creation is not just collaboration, it's the foundation of effective, lasting public health interventions.
So a super helpful overview of some of the topics we'll be discussing today in the webinar around what exactly is co-creation, why is it important, and how can we think about integrating it into our research and interventions and public health practices. So to start and get us into some of the meaty substance of the conversation today, I'm going to actually invite Danielle to start and give us an overview of what co-creation means in a public health context and why it's such a vital approach to tackling complex health challenges. So the floor is yours, Danielle.
Thank you so much, Joe, and thank you to everyone joining. And I want to start off by saying thank you for all those making this webinar happen. I think this is an incredibly important discussion. And we kind of have a running joke with my husband that my baby's first word is going to be co-creation because she hears it all the time. So yes, it's an important question. What actually is co-creation? And I think the video starts out with a very good summary of hitting the kind of highlights and points. My research is really about how you take this concept of co-creation and ensure it's a scientific methodology that addresses really important, complex, and wicked problems that we face in the public health field. And those complex problems are essentially problems that have all these different multifaceted aspects that are causing the problem. And therefore, it's really difficult to kind of have one institution or one organization solve it. Often you may need a mix of different interventions. So what co-creation does is it helps you first identify who is the closest to that problem, who is suffering from it, who actually can influence it, and then guides them through this process, this very structured, yet still a little bit flexible process to tap into something called collective intelligence. And collective intelligence is essentially this concept that we are smarter together than we are on our own. It's not that we're smarter by collecting a bunch of knowledge and pushing it together. It's that you get guided through this really interesting process that kind of brings up that knowledge in real time and helps you create something that no one person can think of. And I think that's what's really exciting and quite interesting about co-creation and why you do need this structure to ensure transparency and trust and true meaningful engagement. The reason it's important is because our current status quo is not really meeting our needs. Often we do have some interventions and it's great to develop something and then implement it. But often when things are implemented in the real world, they fail. And this is not for a lack of expertise or knowledge or time that people spent creating that solution. It's because the real world is complex and messy. So co-creation gives you that ability to actually design it in the real world with the people that you want it to affect. And that way you can get some very powerful, sustainable, and impactful outcomes. So that would be my summary.
Super. So thanks so much. And let's move straight into the first panel discussion here around co-creation and some of the themes that you've already started to pick up around what is it and why it matters. So one of the key points that I picked out is that you describe co-creation as being more than participation, and the wording you used was it's a structured way of working. Why is that an important distinction, and how does it actually shape how we approach some of the health challenges we're working with?
Yeah, it's a very good question. And sometimes when you say structure, people get scared that you think prescriptive. And I more say structure in the sense that a jazz band is structured. You have people have the knowledge and skills and there's some kind of guidance, but you allow the creativity. It's the same with a really good chef. There's some structure, but they can create it. So in that sense, the structure is important to ensure proper participation, because in co-creation, it's not just about someone participating and sharing their lived experience and their knowledge. That's quite nice, but it's actually about them being able to work together. And as we know, when you work together across different sectors, different fields, things can happen. There could be disagreements, there could be conflicts. There's a lot of these aspects that you have to be able to mitigate and leverage rather than allowing things to kind of fall apart. So that's where the structure comes in. And there's a lot of different methods, participatory methods that can actually enable that conversations to happen, to get the data, and also to mitigate things like power dynamics as well.
And how does, can you give an example in practice of how that type of structure could have an influence on how we approach a project, for example?
So how you approach the project, the structure gives you the kind of where do I start, who should be involved, how should we proceed, when are we done, and kind of whether the outcome is satisfactory. If you feel the outcome is trustworthy and actually represents the knowledge you're trying to gather. So, I mean, there's a lot of details at each of those steps, but that's essentially to guide you in the design.
Okay. And one of the things that you also talked about is this sort of like shared problem definition. So how you use co-creation within an initiative, within a project, within an intervention to actually make sure that there is a shared understanding of what the problem that we're trying to address. Could you elaborate on that a little bit more, or even correct me if I'm coming at it from the wrong approach?
You're very right. Yeah, absolutely. And the problem, this is often, I think, what gets jumped over the quickest, because us as researchers or conveners or organizations think we have a grasp of the problem and, we know what's wrong. We've seen the literature, we've done some field work, and we got it. But the reality is, because of the complexity, we actually won't be able to know the full problem. So it's good to start there to help you think, who should I recruit? Then the first workshop we say should always be, this is what we think the problem is. Is that what you think it is? Do you think this is actually the issue? Is there even a key aspect about the problem that we missed? And then that becomes a way, first of all, for them to give that sense of ownership, because you're not just telling them what we're working on, you're actually building it together from the beginning.
Do you have an example of, and sorry I'm putting you on the spot here, but do you have an example of where researchers have gone into a situation with some preconceived understanding of a problem, and actually through co-creation it's actually helped see it from a different angle and actually understand that that's not how the community perceives the issue?
Yes, I have two examples. I think one example was very positive, and one was maybe we don't need co-creation in this setting, so I think both are important. So the first one was this project called Child Co-op here in Denmark. It's led by Aarhus University with Professor Knud Rom. And I was with them out in Randers. It's kind of a more rural space. And the idea was that we thought, okay, the problem is children are not being physically active. So we need to create some interventions to change that. We have some ideas already of what could work, right? That's normally how we go in. And then we invited in the schools, the local sports clubs, the municipal workers, and the first 3 workshops were actually, okay, is this really the problem? Yes, the problem was there, but we discovered all these kind of innate kind of knots within the problem that we wouldn't have known on our own that are very specific to that community. For example, in Denmark, we assume everyone's going to bike to school. It's accessible, but in that area, it's actually quite far, so the children aren't using that form of transport. So that was something we didn't know ahead of time. So in that sense, it was quite valuable.
Yeah.
I think the other example is where it's quite challenging sometimes with food systems. So I won't name the research group, but essentially a discussion with colleagues who wanted to do a co-creation to change how the food's laid out in a marketplace, to change people's behavior to try and get healthier options. And when they brought in all these citizens and consumers and said, okay, this is the evidence, we think this is a problem, most of them said they don't think it's a problem. And actually, we don't want you to change anything in the shops. And that, in reality, that's kind of where the co-creation should stop, because it doesn't make sense for that setting. There's no motivation and kind of drive from them to take part. Yeah. Super.
We'll have to come back to some of those points, because there are some tricky situations that can arise and that we need to be thought through very carefully. Tiffany, if I could come to you as part of this first discussion. One of the ways that co-creation is often framed is an alternative to top-down approaches to public health, where I guess, a classic example of we understand the problem, this is the solution. So how do you think co-creation can be an alternative to that top-down approach, and why do you think it's particularly important for addressing some of these complex challenges that Danielle was mentioning, for example?
Sure. So I think I wouldn't suggest that it's an alternative. I would suggest that it's the only alternative, especially when we're talking about how we address complex health systems in cities. So first and foremost, no 2 cities are alike. And no 2 neighborhoods or larger communities are alike within a larger city. So we can't assume that a solution that worked in one place is going to work at another. We can't apply a top-down approach and put the blanket onto a situation. We need to go into those communities. We need to go into those cities. We need to meet with the people to understand their real lived experience with the challenges that they're facing. And we do this because then we want to and are enabled to design things that are relevant for a specific community, that are looking at the actual situation, are validating the assumptions that we have as researchers or, as institutions when we're trying to solve problems. I also think, in a co-design perspective, when we go into an urban setting, we all know that social determinants have a massive impact on our health and our well-being. But without taking a co-design approach, we're often throwing blankets and solutions at the symptoms rather than the root causes. And we haven't actually talked with the community to understand how are they interacting with their world? How are the determinants that are a factor in their daily life, their housing, their access to food, how are they actually impacting their abilities to be healthy? And without that, we're not designing solutions that are relevant or contextual. I also think in an urban setting, and Danielle, you talked beautifully about this, there's so many players in that space, and they all have a specific role and a lane, and they're trying to work and stay in that lane. And when you don't bring together people in a space where it helps them unpack their lane and understand that this lane is part of a larger highway and we're all going in the same direction, you're creating solutions that aren't aligned with all of the players in the sandbox. And then you're going to have people who are left out, who are very relevant, not only from an impact perspective, but designing the solution.
If I could pick up on one question, and again, this is a little bit of a joker question, but it's inspired by what you just said. So how do you bridge global evidence base and use that in a process of tailoring, adapting, co-creating, co-designing with a community? So what is the relationship between global evidence, which, in a worst case practice could just be copy and paste and applied and not taken into consideration in context? So how as a researcher invested in co-design and co-creation, do you relate to global evidence base? Or do you actually think, not really a global evidence base?
No, I mean, we have to start somewhere. And Danielle, you talked about this. We begin with assumptions, and then it's about going out and talking about where we think we are and asking if those are the experiences of the community and unpacking how those experiences may differ or may align. And so I think, a great example of this is in my world, we're always talking about opportunities to improve walkability in communities. And so we're often thinking about situations where, we're looking at a neighborhood, we're saying it's not very walkable. That's why we don't see people out. They're not being physically active. We're going to put in some sidewalks. We're going to give them access to green space, and everything is going to improve. But we did this because the evidence said we should do this. It's been proven in lots of different neighborhoods. Great, way to go. Except that we didn't check in with the community to understand why they weren't using that space in the first place. And when we actually go in and we talk to them, it turns out that those communities actually weren't safe spaces to be in a public way. So the introduction of sidewalks made no difference to the use of that space. It actually, it actually made people feel more unsafe because it promoted additional entrance into the neighborhood that they weren't looking for. So we didn't unpack what was actually happening. We just thought, we know this could work and let's go for it.
And so in your experience, what is some of the most authentic ways to approach co-creation in practice, and how do you distinguish it from simply asking communities for their input, which is quite extractive sometimes, right?
Yeah. So I can't say enough. You have to believe in the power of co-creation and get behind it, because if you're not behind it, you actually can't come from a place of authenticity. It will never be there. So I think you have to position yourself, you have to learn the skills, you have to believe that this is the way forward. And as I said, I believe this is the only way forward when we're thinking about complex public health challenges. And really the first step in showing this commitment is taking the time to build the relationships and build trust amongst all of the partners that are in play in this space. It means talking about potentially existing harmful relationships when we're talking about healthcare partners and marginalized communities. It's breaking down power dynamics. It's setting up situations where you have open, equal communication and really establishing those spaces for this trust to be built. And I think authenticity is about the time, the commitment, the resources to doing that. If you aren't willing to take that first step, I think you're not creating the foundation for anything else to work. I also think it's about recognizing that co-creation needs to be from the beginning to the end. It's not, we asked your input, we got your feedback, and here's our research paper, see what you can do with it. It's making sure that communities that are impacted by the research and by the projects that we're working on have an equal playing ground and are a part of all of the steps in an equal way. So they're involved in decision making. They are, leading the charge, and they are implementing the interventions. So they feel empowered to be decision makers. And I think that whole involving them in that continuum is the only way to do co-creation authentically.
Super. I have one last question for you, Danielle, before we move into the next segment, but just building on what Tiffany was reflecting on. I know that your research was actually looking across, sort of doing reviews of the evidence systematically. Is that, and that comes from very practical experience that Tiffany has working in the community in and around Toronto. Is that something that you felt consistently reflected in the evidence base as part of your work?
I think that's a tough question a little bit, yeah. But it's a mix, unfortunately, but that's not against the researchers. It's against the lack of kind of systematic knowledge of how to do it, because really co-creation is not a new concept. It's been around since the 1970s. Its roots are all the way back in like product design. It's actually been quite predominant in placemaking and urban design, and now has moved into public health. So the knowledge is very fragmented, and that was like what our first study came. But we see some great examples, and there's some great researchers who are pushing the definition that does say it has to be throughout every step. And that's what we lean on as well, and try and advocate and just give the guidance and the tools so people know how, because it is quite commitment, like you mentioned, time, energy, and resources are needed to do that properly. And I wanted to add, there's something that from the examples where they don't do that, I won't mention the country, but we were speaking with participants that were invited in by a government to do this kind of co-creation process. And because they felt how it was advertised and then what actually happened, there was a huge disconnect. It felt like very tokenistic, or in the sense that they're invited in and told they have all this ownership, and then there'd be periods of 6 months without any word or engagement. And they left that process deciding they'll never engage in co-creation again. And that's a huge, scary aspect, because that's kind of the dark side of co-creation. We have to make sure we do it well so we don't lose the trust in our communities about doing this.
Super. Sorry for putting you on the spot there, but
great.
I think it's a really important question. And actually, I think it gives us a very nice segue into the next section, which is, of course, we've now started discussing how in theory co-creation works, and starting to get a feel of some of the issues at hand, especially when you're working with communities. But we have a really exciting example of co-creation in practice that Tiffany's able to speak to, which is the Catalyst Grant Program from Mississauga, which is a Cities for Better Health partner city, and that the University of Toronto has been coordinating, and really co-creation is at the heart of that at every stage of the process. So I'm really looking forward to hearing a little bit more about it, Tiffany, and the floor is yours.
Thanks, Joe. I would say that, yes, co-creation is the epitome of what we're trying to do with the Catalyst Grant process and the Catalyst Grant program. But I want to start out by saying that, as a research network, we knew that we wanted to go into the community. We wanted to partner with the community and support them to do on-the-ground interventions. But we also knew that we couldn't design a program for them without them. So I'm going to talk about the program, but I wanted to say first that this entire program has been determined based on their needs, what resources and supports they felt would be helpful, what types of funding models would be helpful for them. And we're really working with them as an iterative process each cycle to refine how we're addressing their needs through the program. So the Catalyst Grant Program is a program that brings together cross-sectoral, interdisciplinary teams who are made up of healthcare practitioners, clinicians, community organizations, academics, municipal and provincial partners. And they are coming together to address projects and interventions to impact diabetes and cardiometabolic conditions in their community. And these projects are focusing on 3 target areas that we heard from the community in the beginning, and that is providing better care and services for diabetes, it's creating healthier living environments, and making communities more healthy. So all of the projects that we're supporting through this program align to one or more of those goals. And The program is very iterative. It involves multiple stages for co-creation and co-design. Every single one of our projects is co-led between a community organization, a lead, and an academic lead. So we're offering opportunities for capacity building and sharing throughout the entire project. And I will say that unlike typical academic institutions, in our program, the community are actually empowered to be the fund holders. So we're doing everything we can to offer an opportunity for an equal playing ground and to think about how decisions can be made differently. The Catalyst Grant Program, as I mentioned, it's a collaborative program and it's a stepped process that we work through. And in the beginning, we involve community in a multi-step priority setting process where we help them to refine the needs that they've brought forward. And we offer them chances to validate this and also to indicate their interest in either being a leader, a collaborator, or even a knowledge user. So they can be involved in multiple projects in multiple different levels of decision making. From that stage, they are facilitated through a number of team development and proposal development workshops where the network and my team really help to support the teams to have conversations around what does trust look like? How are we going to make decisions? How are we going to act as partners, and what does commitment really look like? So we are not only fostering space for trust building, we're actually facilitating these conversations because we know how important they are. Once those sort of workshops and activities have taken place, the network is supporting the teams through planning grants of up to $15,000. And this money and this funding was a direct result of what we heard from the community. And that's, we are busy doing the work that we need to do. We are serving the clients that we need to serve. We need to buy out the time and the space for our organizations to be able to come to the table and think about how we can participate. So they can use this funding not only to buy out the time of their community partners to make sure that the voices who are most often missing are present at the table. They can also use this to structure specific activities around trust building, partnership development, and it's really facilitating that whole upfront stage. While they work through their proposal development, we have a number of teams who are offering capacity building sessions around specific research skills or topics related to the projects. We're offering them a connection to a public health librarian, and we are also offering a dedicated team member who acts as an embedded person in their project team who's ultimately focused on the success of the team and the project. Throughout the process, then we have proposals submitted, and proposals are actually going through a friendly development or friendly review opportunity where the team takes the time to get to know the teams and offer them detailed feedback before the proposals even go to a peer review in order to strengthen their opportunity and to really put the rigor behind the community aspects and the community needs. And so once the projects have gone through the proposal stage and they're funded, the network continues to support them by offering, again, the dedicated research services officer connected to the team. And we continue to offer capacity building seminars and sessions that actually align with the trajectory of the project. So we're thinking about, when are you doing budgeting? When are you doing outreach? When are you doing knowledge mobilization? And we're meeting you in the space that you're at just in time. So I think, this process and this program is really about developing collaborative solutions that are going to work on the ground and supporting teams to be able to have the space and the resources that they need to do that well, so that we're developing relevant, feasible, and impactful solutions. And I think, this would be a great time to go and see some of the participants from this program talk about what it's been like to participate in these activities and to talk about what the success of this program has been from their perspective.
The Catalyst program so far has been great because what it's been able to do is to support us in working through a multi-sectoral initiative to explore young people's sense of belonging in relation to physical activity, particularly in underserved neighborhoods. The emphasis on equity-based priority setting and community-driven research has really reinforced the importance of co-designing in this neighborhood. for students and pulling upon their lived experience.
There are so many different people from so many different backgrounds are coming together, and it's interesting to see how all these different background and communities and a multidisciplinary space can come together and sort of like be directed towards different priorities.
It's really neat to sort of listen to all of the different perspectives of the different people in the room, and we really found quite a lot of synergies between the projects that we were sort of respectively working on. And so just I can imagine collaborating with all of them in some way.
It was interesting to see how those from that group of like large group of people became together and sort of like identified where we can utilize our expertise in order to benefit that research. What was interesting for me was to see the different perspective all these individuals had within their own profession to contribute to one common project.
We also spent a lot of time understanding the local data. So the socio-demographic profiles, the walkability, the active transportation, the fast food access, housing needs, socioeconomic needs. So all of these were really developed and understood more deeply through co-creation with the community.
So something that I've been really embracing in this journey of co-creation and the work that I'm doing with the network is the power of qualitative research. And that's where we get the interesting stories from the different interest holders that we're working with. The really sort of unique strength of this collaboration is just the many different interest holders that come together. All of those sort of voices coming together. I think that's the real strength.
I think it's mobilizing various resources and recognizing how those various resources can come together to create something that's going to have a foundational impact rather than a quick answer to a challenge.
In my personal opinion, this is where the exciting community building stuff happens, right? Where you're able to see and start to tease apart the opportunity.
So that's a really great video, and I think through videos and contributions from community members and project partners like that in the Mississauga and the Catalyst Grant Program, we're starting to get a real flavor of the value that co-creation can bring. I just want to remind audience members to continue to submit questions. I've got them coming through here, and I can see some really meaty questions coming through, which is going to be great. So we will move to a Q&A section towards the end of the webinar. But before I do that, I just wanted to follow up, Tiffany, a little bit. I mean, that was just super interesting to hear a little bit from the project members and community members around the Catalyst Grant Program. Could I ask you two small things? One, maybe just give us a little bit more flavor around some of the, about Mississauga and some of the challenges that Mississauga may be facing, or the community there, what strengths and assets they have, but also a little bit about those projects in particular. What are they working on?
Sure. So, Joe, I think what's really important is to mention all three of those individuals that you saw are all leading projects alongside us at the university. And they're all leading projects that are in Mississauga. And Mississauga has a very large new immigrant population. It's very diverse, and it's actually experiencing higher rates of diabetes than all of Canada. So we have an opportunity to really focus in on opportunities to develop solutions that are going to have an impact and need to have an impact now. And these three examples actually highlight the fact that we are addressing community needs across the life course. So one of the projects that was speaking about is looking at opportunities to build connection to community as a facilitator for physical health and education, and that's looking at young children. Another project that we heard from is focused on young adults, and they are mapping areas and opportunities for activity and healthy living choices in college and university students. And by mapping where they're interacting with healthy choices, we see where they're also not interacting with healthy choices. And this is an important opportunity for us to support design interventions in the environments that those individuals are most actively in. And the third project that we heard from is actually a project focused on supporting nutrition and healthy eating education in food bank programs that are focused on seniors. So you can see through the Catalyst Grant program, we're addressing the specific needs of the community across the life course.
Super. And in that video, we heard some really powerful takeaways from the participating stakeholders and organizations. What were some of the most powerful takeaways or outcomes that you yourself have observed as a passenger in this journey?
I mean, it's been so amazing to see the productivity and the excitement that's coming from these teams, and they're still early in their journeys. You know, these projects that we just heard from are 6 to 8 months down the road, and we know it's a long road. This work isn't going to start and stop with these projects, but some of the initial outcomes that we've seen so far that have been amazing to watch is that the Catalyst Grant program has built synergies across the system that I don't think the partners even recognized were there. And so we've recognized that there are so many shared goals around making communities healthier, and all of the partners actually share the same outcome. So we're synergizing their goals, their visions, their experiences, and we're synergizing these through developing strong collaborations. And these collaborations we're seeing now are now happening outside of these projects. So the teams are developing these strong partnerships and then saying, hey, we actually have an opportunity to do this here, and you're working on this, and can I be involved in this? And even across projects, we are seeing multiple opportunities as people learn what other people are interested in, what people are working on, and their priorities. They're really thinking about how they can do that. And I think a third really amazing outcome has been to see the opportunities for data sharing across projects. So, you know, we're collecting project level data about communities that's actually useful not only across all of the projects, but at a system level. So we're starting to see opportunities to use this data to really inform public health priorities and policies. And we are helping the project level teams understand more about their communities in their backyard. And that enables them to better deliver services and programs that are tailored and targeted to the needs of their community. And I think data sharing is an opportunity for us to all consider, you know, what that looks like in a public health aspect and how that can improve solutions. I think, you know, the last thing that I want to talk about is that these Catalyst Grant projects are becoming real life examples of how and what public health policy and what public health priorities should be. So we are giving them case studies for how to address diabetes and healthy living solutions on the ground. And I think that there's so much potential for these projects to become an opportunity to teach a holistic way of creating something.
So much to unpack in there. Lots of really interesting ideas. One thing that I had is around, so how are the health authorities or the local policymakers engaging in this, and how do they view this as a learning experience for themselves? Yeah,
I mean, we have local health authorities as well as healthcare institutions, as well as municipal governments and city government embedded in all of these projects, because they understand that they have a role to play in the delivery and the services of these programs. And I think what they're seeing is that they're recognizing opportunities to leverage expertise, lived experience, and the programs and services that are already happening that are going to meet their goals. So it's not the responsibility of every healthcare institution or the city to be the leader, but they can drive change by supporting the people who are empowered and have the skills to do that. So they are now able to see what's happening in their backyard, and they're leveraging the data to support what they need to do. I also think that them being connected means that they're actually connecting to not just the real examples and the real lived experience, but they're connecting to real-time data. So we as researchers, we're sitting with data that's 2, 3, 4 years old. They're actually understanding how interventions are unfolding on the ground and what the results of those are, and they're able to pivot and consider how to pivot their priorities right away.
And what I'm hearing in a way is that by having such a co-creation at the forefront of the Catalyst Grant Program, you're in a way, in many different ways, supporting the development of an ecosystem that can take on a life of its own and continue beyond this initial grant program phase. One of the questions that actually Danielle spoke to a little bit is the challenge of sustaining co-creation beyond the initial engagement phase. So what strategies have you thought through, or are you testing out to keep communities actively involved throughout the project implementation? I mean, I guess they're actively plugged in and driving it, so they will naturally maintain involvement. But
I think, yes, they will naturally maintain involvement because they see the impact. But I think that as facilitators of collaborative co-designed research, we need to make sure that we are always considering potential waning engagement and how we can put in place strategies to mitigate that before it happens. So I think, Joe, you hit it on the head. We need to remind them often about the shared goals that they all have come together around and what is that vision that they are all trying to achieve. And when we continuously go back and revisit those shared goals, and they can see how they're individually becoming a part of the solution, and they see the road ahead, that keeps them engaged. They see their individual role. And I think that's another important piece around sustaining engagement. It's not just about them being involved in the project and seeing the impacts. It's about designing roles and assigning responsibilities that brings their expertise, their lived experience, their knowledge to the forefront. And when you feel like you have a personal commitment and a personal responsibility, and that you yourself are adding something to the solution, you're going to show up. And that's I think one of the most important things that I can say. I also think we often don't really focus well enough on the reciprocal nature of partnerships. And what I mean by that is, as researchers, we're thinking, what can they give us? What can they give us? But what can we give them? And what can every person at that partnership table share and take away? And I think if you establish opportunities for reciprocity. So if you establish opportunities for knowledge sharing, for capacity building, me as a researcher, I'm learning more about what knowledge mobilization should look, how to make research into action. You as a community member are perhaps developing better skills to evaluate the impact measures and success measures of your program. And maybe you are now co-authoring a paper together, which never would have been an opportunity for you. So keeping people, alive and in it because they see so many opportunities is the way to keep engagement going.
Super. So we've heard a lot about the benefits and the success when co-creation works. I mean, I can imagine out there in the world, there's been a number of examples of where people have encountered quite significant challenges and maybe things have gone a little off track. Feel free to talk to some of the benefits, of course, but what are some of the challenges that people experience when running a co-creation process, Danielle?
Yes, thank you so much. And yeah, thank you for highlighting those key benefits. I mean, I absolutely agree. And that's why I always say the benefits outweigh the challenges, because that question often comes up. And yes, it's time consuming, it takes effort, but there's the known benefits of making more sustainable solutions and increasing transparency and empowerment. But then there's all these other benefits you just can't predict that just come out, which I think is just wonderful. But of course, complex things have challenges. And some known challenges in the research are, one big one is actually systematic and structural barriers. So because it takes time and funding and resources and bringing these people in, sometimes our current systems, both in research institutions and organizations, don't provide that time and space to do it properly. And you can see that kind of cutting off the process too soon, or not providing funding to pay people for their time, and all those kind of aspects come up quite a lot. The other thing is topic drifting and lack of commitment, because it is such a iterative, flexible process. There is risk that, oh, wait, this is interesting, and you can start to go down a different path. And it's just really important as you've mentioned, to keep people focused on what is the shared goal and what is it that we're actually trying to achieve. And those things are interesting. Let's save them somewhere, but let's stay on track. And that comes in with the kind of facilitation approaches. And the commitment and motivation, I think you've touched on that a bit as well. Mm-hmm. It's a challenge because naturally we all have our own personal motivations of why we take part in something. And it's important to start out your process to actually map those out and make it clear to everyone, why are we in this together? Why do we want to take part in this process? So then we can kind of align our motivations to the larger goal and be able to keep going. As well, there's also the challenge sometimes recruitment. Simply just trying to get people on board and find the target groups is a big issue. And that's when people then try and tap into community organizations that already engage with those target groups. And there's different ways to deal with that. But I get the question often, what if I don't get the people I need? Should I just not do it? And in reality, you do have to go back and try and recruit properly as well. Yeah.
Super. And what I think both of you have spoken so far during the webinar around power dynamics and the role of power sharing in co-creation. And so how do you think about designing a process that is actually enabling all co-creators to have an equal voice?
Yeah, this is a very hot topic, I think, and a very challenging one. And I think first it's good to acknowledge that we're always going to have power dynamics. We can do our best to mitigate them and try and equalize things, but they do exist in society, and we're essentially co-creation's a mini society as you're working together. But there's ways to mitigate that. So one, I think you mentioned with the Catalyst grant, was actually providing funding to the organizations that don't typically come in with the funding. So for example, if you're a research institute with a grant to run a process, find ways to pay at least equally to those that you need to be taking part in the process, like key players. Another aspect is actually kind of being smart about your design, because power comes in with the people, but power is also about how you ask them to contribute. And often I think we lean too much on people speaking verbally out their opinions in front of a group, the kind of classroom style. Obviously, not everyone feels comfortable and confident communicating that way. That doesn't mean separate them and have them go in a separate session or just interview them alone. It means be smart. Use written forms where they could provide their input on Post-its and then bring everything together so things are not identifiable. So it's now this is what the group thinks. Could be one way. Other ways are using arts-based methods, different ways of communicating things, these like different levels of knowledge that don't always come through with words. And finally is doing, like you mentioned as well, this collective decision-making, like making sure that everyone's part of the decision-making process. It could be as simple as, live polling anonymously or dot voting within a session or sending out and doing some polls online. So just making sure that you think about, okay, who is driving this?
Super. I have one more question for you. Yeah. Actually comes in from the audience, and then I'll bring Tiffany back in for the wider discussion. So I think it builds directly from this question around power dynamics, and I think in the context of serious chronic diseases and healthy or unhealthy environments, sometimes there are some health harming industries that may be trying to get involved. How does that play out in the example you gave around food systems and some of the changes there? Do you have any reflections or considerations on that? I know it's a surprise question, but it's interesting.
It's a good question, and thank you to whoever sent it in. It's definitely a challenging area within co-creation, and I think also in health in general and working in public health. So first of all, if you're going to, if you invite them in, and you see that they're an important player. So for example, trying to change the food system, you need to bring in the grocery store owners or something like that. Then that's the first step, is really doing what I mentioned before, is this like motivation mapping and like being very clear as a group. Okay, this is why I'm taking part in this process from my positioning. I'm taking part because, I care about having healthy options as an individual. Maybe the organization is taking part because they're worried about a policy that's going to come in and kind of pressure them to change their systems. It's okay just to do that transparently. And then being able to prioritize and map those and like as a group build, okay, what is our shared goal considering these specific objectives that we come in with is one way. If they're trying to push in, they're not invited. I think I would not necessarily bring them in unless they were mapped on your problem as a key stakeholder that needs to be engaged. And then making sure that you can mitigate, I guess, the way the discussions go. That comes with the design, ensuring that they don't dominate processes or discussions, and that you kind of recognize where their voice is coming in throughout the process. That would be my take.
Super. Thank you. Tiffany, we've got some questions coming in around how to co-create and co-design with an equity lens. I mean, I guess it's been implicit through a lot of our answers is like equity is a really important reason why we may do a co-creation approach. But perhaps you could speak more explicitly around how you build in equity into some of the co-creation processes you're driving in Mississauga.
Sure. So I think it's about sort of doing that initial mapping to understand in a situation who are all of the players. And then you ask yourself, okay, these are the players that I know are in this space. Who are the players that are also in this space that I don't know? And it's making sure that they have an opportunity to come forward. So you're building in an opportunity for dialogue across all of the partners. And it's not just the community organizations who continuously show up. It's finding those that are impacted that don't show up. And it's really about thinking about ways to go meet them where they're at. And this isn't engaging them and saying, oh, well, we sent out a survey and you didn't fill it out. And so that, that was your opportunity to have a voice. This is being active about your engagement strategy. You go out and you do what you need to do to make sure that those voices are empowered. You offer them multiple modalities. You go visit their spaces. You leverage the organizations that are already working with those individuals to develop partnerships so that those voices come forward. So I think that's sort of how you build in equity throughout. And then I think when it comes down to the roles and responsibilities, you make sure that equity is at the forefront of the roles and responsibilities. And I always really think about and encourage teams to, when they're developing roles and responsibilities and they're having these important trust building conversations, to apply a step up, step back situation. And by that, I mean, if you are an organization or you're an entity or you're an institution that's usually empowered and usually speaking, take the opportunity to step back. And if you are the voices who are most often left out of this situation, you step up. And you step up to speak, but you also step up more often. And so we are creating processes that really push that to be the way to communicate.
And then I guess building on this, because we're often working on health or social issues that have inequities at the heart of them, and there are often systemic barriers. One of the audience members is asking around how do we ensure these initiatives or solutions that come out of co-creation processes don't just provide short-term relief, but actually dismantle root causes of inequities.
I mean, great question to whoever sent that in. This is something we're still working through actively. As I mentioned, a lot of this work is really still in its infancy. But I think when you are co-designing with community solutions, you're going to get things that are not only relevant and feasible, but scalable. And that's the huge opportunity that we have with co-designing interventions, is that we see and we've asked ourselves, as you mentioned, like we've gone through the process steps. We can then take that intervention and understand how it was applied to address a root cause rather than a symptom. And we can go through those steps again in the next context to replicate a similar solution that's contextual. And each time that you replicate that individualized process with the community that it's impacting, you are ultimately creating things that are relevant and will address the root causes versus a blanket system solution.
Super. And now I guess the next question is a couple of questions that I'm going to merge, but it's, I guess, how do you build and design co-creation processes that are targeting communities or groups of people who are difficult to reach? So one of the questions is asking about specifically getting the views and input of young children. Okay. And another one is talking about extremely marginalized communities, whatever that reason that may be. Do you have any examples, Danielle, of tools and approaches that could work for some of these communities that are harder to reach?
Yeah, absolutely. And I think it's a very important point because we don't want to kind of repeat the sins of the past where we only engage with those that can engage. So I'll start with children. So with children, actually, there's quite a lot of research about how to co-create with children. And we even have some colleagues testing that in Ghent in school settings. And essentially, you have to come to children the way that they communicate. So you need to make sure you use more of these kind of arts-based or tactile methods. You might have them play with Legos and build systems, and then you can talk to them about what it represents rather than putting them in a room and interviewing them. You can have them working with each other and like building collaborative art designs. And for example, in Glasgow, we hosted a kind of mini co-creation session with children. And it was school children from 6 all the way to 12. And essentially the question was, if you could redesign Glasgow and your image, what would you do? And we didn't just ask them in a very kind of classroom-based setting. We all dressed like Harry Potter characters. We invited them in. We had music. We had art materials, and we were asking them to create that vision together on like one canvas. And what came out wasn't just kind of, oh, pretty picture. They were bringing some really interesting things forward about they want more green spaces to engage. They want more healthy food, like surprisingly more fruit near their parks and things like that. So it's really quite nice to see how you can tap into the children's vision and knowledge. And interestingly, in my recent research, it shows one challenge with that is often the parents, of course, you kind of want the parents to come along, but they find that the parents can influence the way the child engages, what the child responds to. Sometimes they even want to impress the parents. So it's really about finding ways to give the parent a task to the side and then create that safe space for the kids to really express themselves.
Super. Tiffany, do you have any reflections on sort of some of the more marginalized communities? And then I think we need to wrap up.
Sure. I think I would say it's about understanding, why are they marginalized, and what factors have you imposed on them that you assume that they're in this situation. And if you assume that they're in this situation, or that they are, then you can't just go in and expect them to engage with you. You've done nothing to develop the trust. You've done nothing to develop that dialogue. You don't actually warrant that communication. You don't warrant that engagement yet. So you actually need to take a step back and say, have I checked my power dynamics? Have I really talked about what my goals are? Have I heard what their goals are? Have I thought about how I can bring a reciprocal nature to this engagement opportunity? So some things that we try to do are going out by saying, we'd love to engage with you, and this is what we can offer you, before we even ask if they're willing to engage. And I think it's, offering then different modalities, flexible opportunities, and also really importantly, compensating their time for engagement. Are you making sure that they have access to engage with you, to transit? Do they have childcare? Are you providing opportunities for food? Why should I take time out of my life to engage with you when, I don't see what the necessary opportunities are for me?
Super. There are plenty more questions that I could have asked, and I think what we'll make sure is that they're passed on and we can come back with some answers to those whose questions weren't answered. But that brings us to the end of today's City Health Talk. Thanks to our incredible panelists, Danielle and Tiffany, for sharing your expertise and insights. I mean, I'm exhausted, but in a good way. I think it was a really stimulating discussion, and hopefully the audience also found it super informative. What we've heard today makes it clear that co-creation is more than a scientific methodology that lives on paper. It's actually something that we can use in a day-to-day practice and use it as a tool to work towards more inclusive, effective, and community-driven public health solutions. It's not always plain sailing. There are some challenges, of course, but we do have some tools in our toolbox to try and work around those challenges and think around how we can leverage them for the best outcomes. Finally, thank you to you all online for joining us and engaging in this conversation today and all the questions that came through. We really appreciate the commitment and participation, and hope you'll join us at future City Health Talk webinars. Until next time, and we look forward to seeing you at the next one, which will be on the 25th of June. Do follow us online or look at our website, citiesforbetterhealth.com, and like our content and engage and send through your ideas for future topics. Thanks so much and have a great rest of your day. Bye.